Good morning. Very fine, thank you.
Okay. Today we are discussing hypertension, often called the silent killer, because many people have it without knowing until serious complications occur. To help us understand this condition better, stick with us on Women Radio 91.7 as the doctor would explain. We're live on YouTube at Women Radio 9. Wait, we're live on YouTube at WFM 917, and you can listen to us on the go via our website at www.wfm917.com. Okay, so doctor, let's take it from the bottom. What exactly is hypertension?
So, hypertension is basically, in layman's words or in plain terms, high blood pressure. The blood pressure is
Okay.
the pressure needed to maintain blood flow in the body. So, when you go to the hospitals or the pharmacies and you measure and you ask them to measure your blood pressure, you they always give you two numbers: the
Yes.
upper, which call systolic, and the lower, which we call diastolic. And these two numbers indicate different aspects of the heart beating. So the systolic, meaning that that's when the heart is pumping, like it's contracting, pumping the blood, and the diastolic when the heart is at rest. So those two numbers are important for hypertension and blood pressure. So whenever it's high, above a certain threshold, that's when we call it high blood pressure. So
Okay.
currently, the diagnostic criteria for hypertension or high blood pressure is systolic, like the upper number greater than greater or equal to 140 millimeters of mercury, and the diastolic, the lower, greater than or equal to 90 millimeters of mercury. And before even hypertension, you even have pre-hypertension, right? So that's within the range of above 120 for the systolic and above 80 for the diastolic. So between 120, between 121 and 139 for the systolic, that's where you call the pre-hypertension, and for the diastolic between 81 and 89.
Okay.
So yeah.
Okay, we're listening to you, doctor.
Oh yeah, so anything below the below 120, or from 120 and below, and then from 80 and below, we consider normal. Although, I mean, this is for the general population, right? There are exceptions to these rules. You can have slightly above and still be within your normal range. But we'll try, for since we are going for the general public, we'll say 120 and 120 and below, and then 80 and below for hypertension.
Okay,
I'm
doctor.
sorry, for normal blood pressure.
Okay. So, how common is hypertension in Nigeria, and should Nigerians be worried?
That's a very good question. How common is hypertension in Nigeria? Very common. In fact, so common. So there's a study that says that was in 2021, that one in almost one in three adults from age 20 and above, not from age 40, not from age 50, from age 20 and above, almost one in three have hypertension. And less than half of those people are aware that they have this hypertension.
Hmm.
And even less than that are treating it and having it under control. So hypertension is something that's very, very common. It's not just about a disease of old age, or it is, yeah, of course, the older you get, the more likely for you to have it. But for our own demographic, you can have it from as young as 20 years old, even younger than that, in fact.
Hmm. Okay,
And it's
so
not something that's, sorry if I may add, it's not something that you should be too worried about, because there's treatment, there's a way to manage it, there are things you can do, like things to improve, which we'll probably be talking about very soon. So it's not something for people to be worried about when once they go and check and they see that their blood pressure is high, or they are told their blood pressure is high. It's not, oh my god, what's going to happen? No, something that, okay, what do we do next? All right.
okay, so doctor, what you're saying basically is that both the old and the young are in risk of having hypertension.
Yes, the old more than the young, but still both are at risk of having it.
Mm. I always tell my brother when he's shouting, young people to have hypertension. Anyway, what are the major causes of hypertension?
We don't really have causes, more we have, more like we have risk factors,
Mm.
things that are likely to predispose you to have hypertension, things that will tip you towards the path of hypertension. Number one, of course, is family history. If you have a family history, like a first order, like a immediate family who has or even an extended immediate family who has hypertension, you are more likely to have it.
Mm.
Another one is being black. Now, since we are all in Nigeria, most of us are all, I mean, if not all of us, are all black. So, but I'm talking about in general population of the world. Black people
Like,
are.
what you should hear. When you say black, are you saying pigmentation or race?
I'm talking about race rather than pigmentation. Mm.
Okay, okay then.
So, being of African descent, basically, or
Okay.
sub-Saharan African descent, will increase your risk or your chances of getting hypertension. Our diet, the kind of diet that we eat, hmm, salt, salty food, also increases your risk of getting hypertension. Oily food, too much oil in your food also increases that. Smoking also increases your risk of hypertension. Alcohol, so people who take alcohol chronically, which we are seeing more and more nowadays, increases the risk of, especially in the young people, increases your risk of having hypertension. Um, we have familial disease that can increase your cholesterol, like runs in the family. Also, that increases your risk of having hypertension. Um, Sedentary lifestyle, meaning that you are not physically active. So in that study that I was quoting, they also showed differences between rural and urban areas, and they showed that in urban areas you have a higher what's it called, higher
Student,
numbers of people that that have the hypertension, all because of their sedentary lifestyle. Nobody is really moving as much as they used to back in the days.
oh well, since it's called the silent killer, are there any warning signs people should look out for?
So for hypertension, that's the problem with hypertension, is that you don't really know when it's happening until there is already some damage going on in the body. Hypertension by itself, increased blood pressure by itself, is just the body's mechanism of coping with something that's going on inside the body. Say the heart is not, blood is not reaching particular organs, the heart pumps harder, it increases blood pressure. Or you have some pathological changes in the blood vessels, making the blood vessels less elastic, less elastic. It increases the blood pressure also. So you will not really feel anything. You may not feel anything. Sometimes some people, luckily for them, they start feeling just generally tired, or body pains. They go to the hospital, they check, and they find out, oh, hypertension. Those pains also might be because of something else that made them go to the hospital. But in general, it's asymptomatic. So you don't have any symptoms, you don't have anything to point towards, like, oh, okay, this is hypertension. And when you start having these symptoms, usually it means that there's some damage going on. If you're having a headache and you're having hypertension, just the headache is just there because of the hypertension, means that your brain is already getting damaged. You're having chest pain, like some heart symptoms, and the only cause that we can find is because of the high blood pressure. It's because the hypertension is already starting to damage the heart. So, and it's usually in the later stages you start finding the symptoms rather than in very early stages.
All right. What happens if hypertension is left untreated?
Okay, that's another very good question. If left untreated, it's of course it gets complicated. You start
Mm.
having what we call end organ damage. So end organs like your eyes, your brain, your heart, your kidneys, even your liver. Hypertension starts affecting these organs. And once it gets there, that's when you now start seeing people coming to the hospitals with chronic kidney disease, which hypertension is one of the most common causes of in this country. Hypertensive heart disease, from the name hypertensive heart disease. Even other cardiovascular disease, hypertension is a common cause of this disease. Heart failure, hypertension is a cause of it. So, stroke, hypertension can be a cause of it also. So, when it's left untreated for a long time, you have these complications. And honestly, we no one want we don't want to have these complications because these are diseases whereby it can be terminal, meaning that once you, for the brain, for example, once you have a stroke, there's always, most of the time, a drawback. There's always some complications of even the stroke. Even after recovery, you still have stroke. After recovery of a stroke, your likelihood of getting another one even is increased. So,
Mm.
left untreated, hypertension can lead to this organ damages, and it's the effect of these things we do not want them. Even as doctors, we don't want to see patients having this.
All right, doctor, you mentioned, yeah, five organs: the liver, the heart, the eyes, the kidney. What was the last one? Beg your pardon.
The brain.
The brain?
Yes, yes.
Okay, yes, liver, heart, kidney, eyes, and brain. Are those five organs the most affected by uncontrolled high blood pressure?
I would say yes.
Okay.
Well, not, I wouldn't say most affected, but because they are very, very sensitive organs, the liver can even take more damage than the rest of them. But these organs, if if damaged, the repair and the way for them to get back is more difficult. The eyes very, very sensitive to changes. You don't want to have hypertensive retinopathy because eyes, you really can't. The brain also, it's another very, very sensitive organ to damages. The heart, yes, then the kidneys too. They are very, very sensitive to damages, especially long-term damages. The liver also, but liver is an organ known for its regenerative capacity, but still, we should try and avoid liver damage from hypertension and other diseases.
Okay, anyway, it's 20 minutes past 10 this beautiful Thursday morning, and you have been listening to Dr. Ademi Jibril Olamide, a general practitioner, talk to us about hypertension, a silent killer we often ignore. Our phone lines are now open. You can call us on 07000 or 09155 or 0800 You can send a text, WhatsApp message, or even a voice note to 07031 756 or 08155 You can text us, send a voice note, or call for any questions you have for the doctor. The doctor's contacts will be shared at the end of the program. Okay, so Dr. Jabril, And hypertension affects a person's quality of life even before serious complications develop.
So, like I said, it's asymptomatic, right? You don't really see any symptoms. So before complications develop, before it really doesn't really affect you, and that's why people move around without knowing that they are hypertensive, right? So you don't really have any side effects whatsoever. So people, you can see someone walking with a very high blood pressure. We've seen it before, and nothing is going on with them. They are going about their work. The only reason why we see them is because, oh, they're having a headache or they fell and they were brought to the hospital. Otherwise, so I even saw one who brought his sister to the hospital and just said, okay, let me check. And when we checked the blood pressure, over 200, and we were like,
One
what's
brought
going
his
on?
sister, and he
Yeah,
also has high blood pressure.
yeah. So we checked. He said he wanted to check by himself, just for checking sake. He checked and he saw it was quite high. And hypertensive, when it gets high, like as high as 180 systolic and 110 diastolic, we start calling that hypertensive urgency. And when there's an end organ damage, for example, you're having headache or you're having chest pain, that is an hypertensive emergency. So things need to be done quickly to stabilize the patient. We need to assess the patient. But he was not even having any symptom, nothing with that high blood pressure. So what we did for him was just to reduce it gradually and then let him rest. And then from then, we prescribe medications for him, ask him about his history to know if he has had this before. If it was, and he was saying no, he didn't have this before. This is first time. So we asked to see him again to assess the situation again, and then prescribing some antihypertensive medication. We start small first, and then we increase it depending on how it responds to the medications. But yeah, there are other aspects of treatment of hypertension to which we'll probably talk about soon.
Okay, so what other aspects are there? What lifestyle changes make the biggest difference? Yeah, difference.
The biggest difference in lifestyle change, if I remember correctly, is exercise, especially for people who are overweight. I mean, you can check your BMI. There's a calculation. You go, you check your weight, you check your height, and you find your range, whether you're overweight. And if you're overweight, exercise makes a very big difference for you. So bringing down your even as much as 1 kilogram, you start seeing effect of as much as 1 2 kilograms, you start seeing effect of your blood pressure dropping. So exercise, not only is it good for bringing down the blood pressure, it's also good for the heart and long term. Exercise on the heart, especially when you now get older, it's just good for your heart, for your cardiovascular system. So that's number one, exercise. And WHO recommends that you have 150 minutes of at least 150 minutes of exercise every week for you to start seeing an effect. So that's 30 minutes every day, Monday to Friday, or 50 minutes um every other day. So Mondays, Wednesdays, and Friday. But I mean, mine, I usually tell my patients 30 minutes every day, and don't wait until the first of or until the Monday. Start from now. And in our climate, exercise, yes, it's not exercise under the sun, right? If you cannot go to the gym or go to an enclosed area, it's not exercise under the sun. You do it in your environment, but early in the morning or in the evening when the sun is down, because you don't want to have a heat stroke or a sunburn while you're exercising. And the exercise I'm talking about is light jogging, or you're walking fast enough that you are getting out of breath. You're walking like you are late. You're going somewhere, but you are late already. So you're walking as fast as you can, right? So these are the kind of exercises that help, like moderate exercise, right? So Then you have your salt. You know, I was talking about salts. These are like modifiable risk factors. Salt and oil, and like both vegetable and red oil. Those things also need to reduce. Salt, for example, when we're eating food. Um, in Nigeria, we eat a lot of salt, or put salt in our rice, we put salt in our stew. Sometimes you see people putting salt on the egg, boiled egg that they are cooking. So there's a lot of salt. So when you want to eat food, for example, what I tell my patients is that okay, I'm not saying that you shouldn't eat any salt, or just reduce it. The amount of salt that you put, for example, if you are eating rice and you're eating stew, rice and stew, you're already putting salt in the stew. There's no need to put additional salt in the rice.
Doctor,
So eh, eh,
the rice will be bland.
if you mix it with the stew, it's not going to be that bland. That's the essence of having stew. Like the stew give it some taste. And
Don't worry,
yes,
put
you are
small.
right actually.
We'll put small in boats.
No, like just well, okay, fine. Put more in both. But it's going to be bland, yes, in the beginning. This is another thing I also tell patients, that it's going to be bland when they say it's going to be bland. But you will get used to it. Your
True.
body would adapt, your taste buds will adapt, and you will get used to it. And once you get used to it, taking salt in that rice will put you off. Like who puts you will be like, "Ah, no, I don't want this again," or it will be even become too salty for you. So once you start getting used to reduce salt, in the beginning it's going to be bland for sure. It's going to taste somehow. But after some time, you get so used to it that even putting salt in it, you will not even like it anymore. So
Hmm.
it's for the greater good, right? It's not
Yes.
yes, we want to enjoy our food as much as possible, but for long-term effects, for the benefit of living a long, healthy life, not just long life, healthy life, we should start taking these practices into account.
Okay. How important is regular blood pressure screening, even for people who feel perfectly healthy?
For people who feel perfectly healthy, maybe I would recommend once a week check, just because of our inherent risk for having hypertension and just the statistics alone. Once a week, check your blood pressure, go about your daily life.
Okay.
If you are told that you are hypertensive, or you have pre-hypertension, for example, and you have not been placed on any medication, I would even say you should start going every day, checking
Hmm.
your blood pressure every day, just to monitor it so it doesn't cross the threshold. And you record it. It's not you check and you say no. You check. You record. You have your booklet. You record it so that whenever you go to the hospital next time, you have a record, and the doctor say, okay, this has been the blood pressure over so and so days, and you and they then decide, okay, well, this woman, she's hypertensive, let's put less on this. Some people will even ask them to check it morning and night in specific times, because blood pressure also changes depending on the time of the day, depending on you have hormonal changes too in the body. So depending on the time of the day, blood pressure changes. So we ask them to check morning and night, and then we see, okay, is it at night that the blood pressure rises more, so that we know to tell them when they should be taking their medications, what time they should be taking their medications.
All right. Thank you, doctor. What are some common myths Nigerians believe about hypertension that you would like to correct today?
So a common myth, and well, it's not a myth because some parts of it are true, right? So the common myth would be the hypertension. If a young person, like say 20, 21, is hypertensive, it's because they are thinking a lot. It's because you hear people say, keep on roll. What are you thinking of? Sometimes it's not because they are thinking. Yes, if you are thinking you are stressed, it will increase your blood pressure. Stress can also increase your blood pressure. Also, being sick can also increase your blood pressure. But sometimes they just have it. And um, when we say that to people, they are always when we say like people are thinking too much and that's why they're hypertensive, it increases stress. It makes them a little bit more stressed because I say, but I'm not thinking about anything. Then that they not start thinking about what they're trying to think about, what's stressing them. That also increases the stress. So sometimes, yes, it might be that they are thinking, but if they're not and they're having it, just tell them to go to the hospital, let them get checked, find out their family history. It might be that both parents or every other person in the family member is hypertensive. You find
Mm.
out the cause of the hypertension, whether it's because there's an underlying disease or there's something else, and then you treat. Not yeah. So it's a case by case, but not always stress that causes hypertension, especially in the younger population. Another myth would be that hypertension is only in old age. As I said, you can also have it from 20 and above. In fact, younger. We've seen, although these are peculiar cases, we've seen cases of children also being hypertensive, like having an increased blood pressure. Of course, this usually is because they have some underlying disease. Mm.
Okay, so doctor, I want to be able to quote you. That is why I'm asking you this question. Can shouting and getting angry cause hypertension? Because I'm always telling my brother when he start getting angry and he's shouting that younger people too have hypertension. So you should take things easy so he will not have hypertension. Is that medically correct?
No, I would not say that's medically correct.
Why now?
Well, because again, there's no cause of hypertension, more like risk factors. That's number one. The second part is that shouting inherently would not cause hypertension.
Okay,
Maybe the stress, chronic stress surrounding the why the person is shouting might cause it, sorry, be a risk factor for it. But
okay,
shouting in itself and getting angry is not a cause. Has not been written as a cause of hypertension in textbooks.
okay. Finally, what is your most important message to anybody who has never checked their blood pressure or has been ignoring their diagnosis?
So, um, ignoring. Okay, now, okay, for checking your blood pressure, just check randomly. Doesn't matter what you have. Just check.
I can
Find
check
out.
myself, right?
Well, you can, but you should be trained on how to. So you should know how to check it yourself. You have thankfully nowadays, more and more people are having these automatic machines,
Yes.
these manometers. So you can check yourself, but you should be taught on how to check what you should do. For example, how to place the cuff on your arm. Um, you should not check while you are walking or after taking coffee or anything that has caffeine. You should be well rested, meaning that you should have been sitting on your chair for at least 5 minutes, ideally, and then before you now it's the start on button on the machine, right? And you can always go to your local primary health center, sometimes your pharmacies, to go and meet them because they have these machines and then they can teach you on how to check your blood pressure. So you can always check yourself at home. You can also ask someone to check for you, like your younger family member or your spouse or relative, anyone. So yeah,
Okay, thank you so much, Dr. Jibril Adeyemi, for sharing these valuable insights with us. Hypertension may be silent, but with regular checkups, healthy lifestyle choices, and early treatment, it doesn't have to become deadly. To everyone listening, take your health seriously, know your numbers, and encourage your loved ones to do the same. Until tomorrow, stay healthy and take care. Have a wonderful day. Have a wonderful day, Dr. Jibril.
thank you very much for your time, for having me.
Okay. Good morning.
Good morning.